Hi sir, I am myself Bose Karthik. I have a master's degree in biomedical engineering from IIT Madras. Here in this video, I would like to enlighten our society by providing a lot of useful insights into the ongoing current COVID-19 pandemic, its mechanism, preventive measures, and what lies ahead of this pandemic to us as a humanity and society together. Although we are going to enter into the ending stage of the current ongoing wave, it's very unlikely that this disease is going to disappear from the face of this world, at least for the coming 10 years. This is because it becomes an endemic just like flu due to the imbalanced distribution of vaccines between different developed and poor countries, and also due to the evolution of new variants. The solution here is that we should learn to live along with the new virus. We have already seen the deadly variant in 2021, and currently we are seeing the fastly spreading variant in 2022. Countries should get ready if the virus comes back with a new strategy in the future, which might be the hybrid of both. For example, a global alerting system might be a good solution. In order to coexist with the new virus and to effectively tackle the new variants that might be coming up in future, it's very important that everyone understands the insights into the COVID-19 mechanism. Public also should try to enlighten themselves by increasing their scientific knowledge with this video. Now let us look into the other factors that play a crucial role in deciding the severity of this disease. First reason is air pollution. For example, air pollutants like cigarette smoke extract, particulate matter, bushfire, soot, diesel exhaust, silica dust, and LPS in air acts as airway inflammants. Long-term exposure to these air pollutants or inflammants leads towards the inflammation in human airway epithelial cells. As a result, oxidative stress increases, which in turn increases disulfide bonds at the surface of ACE2 receptors. This makes it easy for SARS-CoV-2 to get conformational change to enter into the cells. Second reason is exposure to nicotine. Nicotine acts as immunosuppressant and suppresses important antiviral responses. Conclusively, exposure to cigarette smoke extract, other airway inflammants, and short-term exposure to nicotine increases TLR4 expression, while long-term exposure to nicotine decreases TLR4, TLR3, TLR7, and RIG expressions in different cells. This over or under expression of PRRs is not good for the immune responses. Third reason is gut microbiota dysbiosis. People who don't have good gut microbiota during respiratory viral infections have been shown to be with less TLR7 expression. TLR7 is very important for the detection of RNA respiratory viral infections. In the absence of sufficient TLR7 expression, people are at the increased risk of viral loads and subsequent damage or mortality rate. This is due to the failure in detection of virus at the initial stages, which in turn makes immune system to promote the immunosuppressive actions through MDSCs. Reasons for gut microbiota dysbiosis include bad food habits, certain gut diseases, and antibiotic abuse. Antibiotic abuse, independent of the route of administration, leads towards gut microbiota dysbiosis, which in turn affects TLR7 expression during RNA viral infections. Bad food habits like eating high fatty foods and not having good bacteria in daily diet might lead to increased systemic LPS. This can be seen in people with comorbidities like obese, diabetic, and hypertensive people. This systemic LPS is bad because it can bind to SARS-CoV-2 and promote both pro-inflammation and immune suppressive actions. Next factor includes vitamin D deficiency. Vitamin D is very important for antioxidant activities in the cells. Lot of people around the world have vitamin D deficiency. Next reason is microRNA dysregulations from existing or pre-existing diseases. Reason is oxidative stress. Lack of exercise or severe exercise or aging increases oxidative stress in body. Next factor is oral hygiene. Oral hygiene is very important. For example, people with periodontitis have LPS bacteria, wherein this LPS bacteria can bind to SARS-CoV-2 and promote inflammatory responses. Next reason is over cleanliness. Humans have been in constant touch with germs. This helps our immune system to stay active by producing associated antibodies from time to time. For example, we are drinking very clean and pure water. The usage of clean water makes our body less exposed to the pathogens or the clean environment, for example. As a result, antibody responses stay dormant for a particular interval of time. Next factor is hot weather. The wave usually starts during November, December and then starts to peak around March, at least in India. This is because as the air becomes dry, it becomes easier for the virus to get carried away easily in air from place to place. Now we will discuss about what if SARS-CoV-2 comes in future. Air pollution, nicotine exposure and comorbidities are important factors affecting this disease. Whatever has happened in 2021 might again repeat at the end of this decade, because by then a subset of comorbid people and then aged people and then people who have been affected by air pollution and then nicotine exposure will come up, and then these people might become subjects of the new variant of the SARS-CoV-2, and the new variant might bypass the immunity that we got from the epitopes implemented in the vaccines, in the current vaccines. So this is the reason why it's very important to come up with a new treatment method, normal treatment method, and understand the underlying mechanism of this disease. I went through vast number of literature and produced the detailed documentation in preprint. I would like to request our scientific community to access it. Here in this video, I'll be providing a brief insights into the mechanism. So novel spike protein promotes rapid cell death in the infected cells. SARS-CoV-2 represses or delays the induction of interferons. It also represses or delays the timely induction of Tregs, T follicular helper cells, CD4, CD8 memory responses, antibodies, and possibly MHC1, MHC2. SARS-CoV-2 can bind to LPS and form aggregate. It mimics secondary bacterial responses and promotes the damage mediated by monocytes. SARS-CoV-2 dysregulates miRNAs, microRNAs, which are very essential and crucial components in the immune system communication. In normal influenza, during first week, innate immunity controls the viral growth and is taken care by antibodies and memory responses later. But in severe COVID-19, antibodies are delayed or found by at least after third or fourth week. Growing viral load stimulates monocytes and inflammation keeps on increasing. SARS-CoV-2 downregulates ACE2. This leads to edematic or leaky situations. Leaky situations makes it easy for the monocytes to influx into the infected site. SARS-CoV-2 dysregulates CD24 cyclic ship pathway, which is important in controlling the inflammation mediated by NF-kappa B. So since SARS-CoV-2 dysregulates microRNA which controls this pathway, the inflammation becomes uncontrolled. Lot of cell damage leads towards damp release. So damage in lungs also leads to hypoxia. So less or lack of TLR7 promotes MDSC induction during extreme cell death. So when these MDSCs are induced, these MDSCs suppress CD8 memory T cell responses. As a result, patient enters into dysregulated immunity, and this ultimately leads to sepsis. For more detailed explanation, please go through this preprint. Now let us look into the common preventive measures. First comes vaccine. Only vaccines can rescue a person from reaching the critical or ultimate stage of the disease. Although vaccines cannot prevent the entry of the virus, they can prevent the person from reaching dangerous conditions. Only mask and safe distancing can prevent the entry of virus into body. Next preventive measure is intake of good bacteria along with diet. Although all commercial probiotics might not be good for health, homemade yogurt or buttermilk might be a good choice. Researchers have shown that certain strains of lactobacillus bacillus or yogurt help in strengthening our respiratory immunity by stimulating the induction of interferons and IgA responses at the mucosal surfaces, and also by maintaining the balance of Treg and Th17 cells, Th1 and Th2, and IL6 and IL10. It should be noted that probiotic consumption might not be good for the people with critically ill conditions or health complications like immunosuppression or immunocompromised or critically ill children or older people. This is because it might become a secondary infection to them. So people with diseased conditions should get consultation from their personal doctor. In this situation, tinderlized or heat-killed probiotics might be a good choice, although this is a subject of ongoing research. Next preventive measure is by maintaining proper vitamin D levels in our body. Everyday sunrise exposure to our body will help us in maintaining this vitamin D level. Coming to the treatments, I wrote a preprint article which might be of use to the research community. You can access it in the link below. Please note that this is a preprint article and yet to be reviewed. Israel made ExoCD24 has a lot of potential in saving severe COVID-19 patients during pro-inflammatory conditions. My suggestion here would be that this efficiency can further be increased by adding anti-LPS therapy to it. Disclaimer: please note that this video is made only for research and knowledge sharing purposes, but not for taking or inferring any personal medical decisions without consultations with your doctor.